There's a lot to be said for being in the right place at the right time. And strange as it might sound, the middle of Afghanistan, with an American television crew doing a story on midwifery, was exactly that. I was asked to prepare the way for a TV crew from NBC to film a story on our midwifery training in Herat, a city in western Afghanistan near the Iranian border. While observing all the strict lines of separation between men and women in the conservative Muslim culture, I still managed to come away with an amazing glimpse of life-changing work. Midwifery is life itself to 1,500 women who give birth every month at Herat's only maternity hospital. That is 18,000 women delivering babies every year in a hospital with only 100 beds. The hands of midwives catch newborns and bridge a tremendous gap in materials and staffing. They literally make the difference between life and death. Like Satish, who was born prematurely, weighing just 800 grams. That's less than 2 pounds. Midwives and the neonatal unit funded by World Vision kept the girl alive. Now, at 18 months, she is full of life. The circumstances of Satesh's birth are not exceptional. Of the 18,000 women giving birth in the hospital every year, 29% experience major complications. Major means life-threatening. But midwives don't merely deliver babies. In rural Afghanistan, where medical services are non-existent, they provide prenatal care. The more midwives trained to work in these remote places, the lower that 29% of life-threatening complications will become. Midwives educate and help change dangerous attitudes. In the West, when a woman learns she's pregnant, she sees her doctor as soon as possible. In rural Afghanistan, the first time a woman expects to see a medical professional is when she's about to have the baby. World Vision has trained 171 midwives so far. They attend classes and lab sessions, but more than half their time is hands-on, frontline training. Given the population of Herat province, nearly 2 million people, some would call 171 midwives a drop in the bucket. But the effect is enormous. Yalda graduated from World Vision's midwifery training in March 2006. Immediately, she was delivering 30 babies a month. That's 1 delivery every day. What did she do with the rest of her day? Examine 20 pregnant women, per day, every day. Now, 3 years later, she is something called a reproductive health officer, supervising midwives in more than 20 health clinics. 20 times the impact in just 3 years. 55% of the midwives she supervises are also World Vision graduates. Steeped in our creature comforts and open minds, for us, the life of a woman in rural Afghanistan is nearly incomprehensible. What we take for granted in our countries, like a neonatal ward with incubators, is equally incomprehensible to people who have been isolated by war, geography, and tradition. But midwifery, as it saves lives and mitigates suffering, also brings about change in attitudes and in practice. It is a bridge across which hope can travel to a place in which hope is a rare commodity.